Hello, my name is Mandy Torres. I'm a FNP student at Roberts Wesleyan College, and this is my PowerPoint on a call into action. The FNP is a research-informed practice provider. Read the introduction. Within this PowerPoint, we will talk about the roles and responsibilities of the family nurse practitioner. The purpose is to highlight the essential role the FNPs play in integrating evidence-based practices into clinical care. And the thesis here is FMPs have a professional responsibility to stay current with the latest research evidence and to apply this knowledge to improve patient outcomes. Another way to say this is that FMPs have to stay current with practice. They have to stay up to date on the research, and once they're up to date and stay up to date, they can apply this knowledge with the hopes that we improve patient outcomes by using evidence-based practices. The importance of research-informed practice. Evidence-based practice is integration of evidence-based clinical expertise and patient values. The benefits of this are improved patient outcomes, improved patient safety, and reduced cost. And within this evidence-based practice style or clinical setting, the FNP's role with all this is to apply the guidelines, to advocate for evidence-based practice, meaning as FNPs, it's our job to look at a situation and say, I really believe that we could benefit tremendously from using this evidence-based practice in particular, or for example, saying that patients aren't getting proper instructions for their preoperative surgeries and the cases are being deemed inadequate. The FNP's role within evidence-based practice is to advocate for that and say the research says that patients who receive visual educational material retain it more. Things along that line. That is the FNP's role, to advocate for that and also to support the initiatives that do come from the evidence-based practice. If an FNP or a team member finds some evidence-based practice and wants to implement a new protocol within the department, the FNP's role is to support that however they can, however that looks. Staying current with the literature, the FMPs have a responsibility to doing that, and they can do so by using databases such as PubMed, CINAHL, or Cochrane Library. They can also use search with Boolean operations, mesh terms, things along that lines. You can do critical appraisal through CASP or JHNEPH. And very, very important here, and you'll see this quite a bit in practice, is continuing education. FMPs can stay current with this by attending conferences, reading journals, webinars, writing in the journals, just always staying up to date on what the most current education says in the literature for the best outcome for the patient populations. This next slide is about translating the research into practice. So what do we do once we find this evidence-based practice as FMPs? What is our job and how do we translate that into practice? So FMPs will identify practice gaps, and they'll do that via assessments or quality improvement data. Their job is to take this information, put it into an assessment form so we can figure out, is this working? Is this not going to work? Do we see a gap? And for example, we could use these evidence-based practices that we find in research and turn it into an assessment tool. Like a health literary assessment to determine do the patients even understand what's being presented to them, say in the preoperative phases of surgery. FNPs will develop protocols with literature, with stakeholders, and pilot testing. Again, intercollaboration is super important, but also have to work with stakeholders so they know why are we doing this. The evidence says this, but we need to, as FNPs, present this to the stakeholders so they're aware of the practice and how it can benefit the patient. And pilot testing, you can start that very early on in any of your implementation phases and use this pilot testing to take the research that you learned as an FNP, the evidence-based practice, the research that you've been doing, and you can put it into this testing to see, okay, this evidence-based practice is working in this facility, but it didn't seem to work within ours based on the pilot testing. The barriers to this, translating the research into practice, is time, the resources, and the support. Resources can be different in each facility, especially if you're working in a rural area where you had resources that may be limited. And another big one here is support. You may see a lot of resistance from staff members within this department on translating this research into practice. They may just seem like they're not interested or they don't fully understand why we have to implement a change. So resistance from your staff can be a huge problem when trying to implement evidence-based practice. The strategies to help increase this information from taking it to just simply a piece of research and putting it into practice, having evidence-based practice champions within your unit or your team. Having these champions allows for staff members to be able to go to an EBH champion and say, hey, look, I'm starting to see that the evidence says this. What are your suggestions? Also, training your staff will help with translating the research into practice and having good leadership. And the evaluation of the outcomes and the compliance within the transition period, right? We want to be evaluating the outcomes and making sure that they're working. And if they're not working along the way, we try to use new evidence-based practices to overcome those barriers and making sure that compliance-wise, patients are following through on their end of the evidence-based practice strategies and the staff as well. The FNP as a role in the model and advocate for evidence-based practice. FNPs are a role model, and the fact that they are very critical thinkers, they're able to look at a situation and model what it looks like within an evidence-based proposal. They look at things critically, they're detail oriented, and they advocate for critical thinking. FNPs are lifelong learners. And they model this lifelong learning to their staff and their co-workers, which, as a lifelong learner, you're always keeping up to date on the evidence-based practices, and they're modeling that within your team. And FNPs are really great at mentoring staff and huge advocates for patients and mentoring the patients as well, tailoring educational needs based on each specific patient, mentoring staff into why we need to implement evidence-based practice currently. They just have a way of portraying the information based on the skills and the education they've learned along the way. They're able to effectively and critically apply the evidence-based practice, and they're also able to model it within those different categories we talked about. Patient FNPs are advocates. They promote policy involvement. They look at the current policies. They say this is what this is what we're currently doing. Let's look at what the evidence says so we can modify policies if we need to. FNPs participate in evidence-based committees. Their skills are used greatly. Like I said, they're good advocates, they're known leaders, and they're also innovative. They participate in an innovation culture. They're promoting that. They're saying, hey, look, we need to adjust this. This is what the research says. We're staying up to date so we can just give patient the best patient outcomes. That is my presentation, and I hope you guys enjoyed it. Thank you.